There's lots of questions going on. We've been talking about getting vaccinated, what's going to happen in schools. If you don't want to get vaccinated, though, be prepared to pay more for insurance. True or false? I don't know.
I don't know either, but that's a good question.
Let's go to the expert. How about that for a lead? And this is Todd Furniss, the author of The 60% Solution, Rethinking Healthcare. Todd, thanks for being with us today.
Good morning to you.
Hey, so that's the main question.
Can you answer the $64 million question, Todd?
Ding, ding, ding.
Well, there's teeing it up, so that can be exactly the case. They're going to, I don't want to suggest that there's like this big conspiracy out there, but what's happening is insurance companies are incurring additional costs, and so the way that things work is that they're trying to encourage, as is the federal government, everybody to get the vaccination. So state governments are weighing in as well. And the reason the state governments are important is because the way that insurance premiums are established in most states in the United States is not because of a negotiation with an individual or with a company, but because of a negotiation with the state departments of insurance. So what's happening is they're trying to encourage vaccination. That's not working too much, or certainly not as well as they'd like. They've tried offering incentives. That's not working very well. And now what they want to do is they want to put an economic risk in for everybody, which will create both social pressure and vilification. In other words, they're going to say, hey, you know what? You guys didn't get your vaccination, and therefore the cost of insurance for everyone is going to go up.
How is that fair? Why wouldn't they just raise rates for those who aren't vaccinated?
Good question.
Well, the honest answer is they don't know who falls into that category.
Oh, right. So it's going to be some time before we even know all of that.
It seems like at some point when you are signing up for insurance, don't they ask you if you smoke or if you're...
How many drinks you have a day?
Yeah, have you ever had cancer or I don't know. Do they not ask that on insurance forms?
They can, and they do. And the question then becomes, well, do you believe them?
Oh, okay.
Oh, yeah, you're right. We all do lie about that. About our vices. No, I don't drink. No, I don't smoke.
I thought a glass of red wine a day was good for the heart.
Exactly. Okay, Todd, what about, do you foresee like a pandemic exclusion?
Those already exist in many instances. For example, there was a story yesterday about a traveler in Hawaii who had a pandemic exclusion from his travel insurance and suffered a $104,000 hospital bill because he got COVID in Hawaii. Now, before we go on too far past this vaccination issue on the insurance form, I also want to point out what happens if you actually had COVID. You're actually more protected than you would be if you had the vaccination. But that seems to be an unpleasant argument for people to handle in the industry. And so what they're just kind of scooting by is, well, we don't know if you've had it or if you haven't had it. But you have to get the vaccination in order to qualify for X, Y, or Z. To sit in the right seats in the stadium, to go to the movie theater, to not wear a mask in the restaurant, et cetera.
Well, but I thought even if you had COVID, isn't there some science that says, yeah, you're protected, but not for long, right? You still probably need the vaccine sometime down the road? Well, let me couch my statements by first admitting, and really this is the way all leaders should act, is say we don't have all the answers definitively, but the early studies are showing, and again, things could change because these are early studies, but the early studies are showing that actually the antibodies that you get from having COVID last longer than the vaccination. Now, everybody's different, and everybody's immune system reacts differently to getting both the vaccination and getting the disease itself. But the early studies are saying that the antibodies last longer than those in the vaccination.
So if this continues, Todd, and booster shots are needed down the road, is that cost then going to be passed down to all of us? And when I say us, I mean those who are vaccinated. That's a good question, because we haven't paid for our vaccines.
Correct. And what about those booster shots that are coming?
So what will likely happen is that there'll be such an urgency about that because Dr. Fauci will so encourage it, that there will be government sponsorship of those vaccinations. Now, that doesn't mean you didn't pay for it. It just it means you didn't pay for it with cash, and you didn't pay for it with insurance. You likely paid for it through your tax dollars.
Right. That makes sense.
Actually, and I say that, and I feel like I got an insurance bill, actually not for the vaccine, but for the test, that they said it was free, but then they actually did charge the insurance company.
Oh, for the test.
For the test, yeah.
Is that
So
the case,
they
Todd?
are paying.
Yeah, so that's a whole different story. And of course, you're correct that insurance companies are charging for tests, just like, and it's not really insurance companies charging. I remember the insurance companies are merely merely paying the bills. So whatever and they do that because of a negotiated rate they have with a service provider. In other words, the testing facility, they created the charge, and they pass that charge on to you or to your insurance company, depending upon your insurance policy.
So
Right.
most of this, and I'm saying the word most, but most of this, the shots, the testing is free now, most of it. But is that going to change, Todd, as the months and the weeks and months and years go on and we start defeating this? Like in a year, if we need a COVID test or a COVID shot, do you see that price skyrocketing?
Well, I want to make sure that we anchor on this idea of it's really not free. It's just paid for.
Yeah, by tax dollars, right. Yeah.
We're paying it anyway, but
Yeah,
we're not seeing the bills. Are we going to start seeing the bills?
exactly.
I think over time what's going to happen is, yes, you are going to start seeing the bills because it's just like any other vaccination that you might need at any other point in your life. And, I'll give you a quick example of something that happened to me, and I wrote about this in my book. But my mother had pneumonia. She was in a very bad plane crash, and she used to be hospitalized every year for 40 years. And later in her life, she had bad pneumonia. She'd be hospitalized. And one time I got the call from the discharge nurse that she was going to be released. I said, that's great. And then I got a call back and said, well, actually, she's not going to be able to go home. She's going into a rehab unit. I said, rehab unit? What's she going to rehab unit? And, well, she needs to get stronger and be able to walk. I said, my mom hasn't walked for 10 years. She hasn't been in ambulatory for that period of time. And they said, what do you care? It's free.
Oh, my gosh.
But
Wait a
nothing's
minute.
ever free, first of all.
No.
Exactly right. And so so we ended up having to pay for it through insurance, a combination of insurance and Medicare. But they put her into a room, a semi-private room with no telephone, no TV, and no radio. And they wanted to keep her over there for 30 days because it was free, and I shouldn't be worried about it. And I should inventory my mother that way, which
Yeah.
of course I did not do.
Yeah, anytime you hear the words free, right?
Yeah.
Red flags
So
go
I
up.
get nervous when people say free.
Yeah, Todd, we appreciate your time. This has been enlightening, and we're preparing you as our public service announcement for today. Todd, thank you so much for being with us.
Thank you so much for having me.
Thanks.